So heat and cold therapy for back pain, huh? It's one of those things everyone's heard of, but it's actually smart to dig in a little deeper, really understand what's going on,
Hmm.
especially if you're thinking of trying it out yourself.
Yeah. And you're not alone, right?
Yeah.
Back pain is so common, affects tons of people. And the good thing about heat and cold therapy is it's often a really accessible first step to finding some relief.
It's kind of like magic, right? You think about just temperature. How can that do so much?
Yeah.
But it really does. So, like, what's the science behind it all? How does heat actually work on a sore back?
Okay, so with heat, imagine it as the signal to your body telling it, hey, we need to boost the healing process here. The warmth, it makes your blood vessels get wider, dilate, and that means more blood flow to the area that's hurting.
Like a rush of reinforcements to help fix things up.
Exactly. And that blood, it brings oxygen, all those good nutrients that are essential for repairing those tissues. And at the same time, it helps flush out the stuff that's causing the inflammation in the first place, like a
Yeah.
two-for-one deal.
So it's giving your body what it needs, but also taking away what's causing the problem. Makes sense.
Yep. And beyond just the physical stuff, heat therapy can be really relaxing too. There was this study back in 2015 in the Journal of Pain Research. They found that when people with chronic lower back pain used heat, not only did it lessen their pain, but it actually loosened up those muscles and even made them more flexible.
Yeah, I mean, who doesn't feel better after a hot bath? Totally tracks.
Right. Okay, so then you've got cold therapy. Think of this as more of a temporary thing. It's like hitting the pause button. You're trying to calm down the inflammation and kind of like interrupt those pain signals that are going to your brain.
So with cold, those blood vessels do the opposite. They constrict.
Right. They tighten up, and that helps because it reduces swelling, and it also helps keep that inflammatory response in check. So it's especially good for those acute injuries, when you've just done something.
So it's like, okay, body, calm down for a sec. We'll deal with this later. But how does it actually like numb the pain? Is that just the cold itself or?
So it's actually about how those cold temperatures affect your nerves. Basically, the cold slows down how fast those pain signals travel from, say, your back up to your brain. And that can make a big difference in how much pain you actually feel, especially for nerve-related pain, like sciatica.
Ah,
Yeah.
sciatica. Yeah, a lot of people dealing with that. So it's like if heat is like sending in the repair crew, cold is more like, I don't know, intercepting the emergency calls for a bit.
That's a really good way to put it. And the thing is, with heat and cold, it's not about one being better than the other. It's about knowing when to use which one. And that can make a huge difference in how you manage your back pain.
This is super helpful.
Okay.
Okay, so we get the why, the how it works, which is huge. But now I'm thinking, okay, in real life, what do I actually do? So what are the ways people actually use heat and cold? Like what are the options and when's the right time for each?
All right, so let's break it down. Let's start with heat therapy. There's a bunch of ways to do it. So you've got your classic heating pad or those hot packs. Those are great. They can really target the heat where you need it. And those are generally pretty safe to use for a while, which is good for like chronic pain or if you're just stiff all the time.
Yeah, those are good for just like hanging out on the couch.
Oh, yeah.
But then you've also got those heat wraps, right? The ones you can like wear.
Exactly. Those are good if you want something a little more, gentle and spread out. Like if your whole lower back is sore, wrap can be good for that.
Yeah.
And you can like wear them around and keep doing your thing.
So if you're like stuck at a desk all day and your back starts to act up, that might be a good option.
Yeah, definitely something to think about. Then you've got things like warm baths, hot tubs. Everyone loves those. And those are great because it's that whole body immersive kind of heat,
Yeah.
super relaxing, which can really help with loosening up those muscles.
Warm baths are my jam. Can't go wrong. Okay, but I've also been hearing more and more about infrared saunas. Is that heat like different or something?
It is a bit different. So like a regular sauna, it heats the air around you, right?
Yeah.
But infrared, it uses these light waves that go deeper into your body. So some people find that really helpful for pain relief, and it can be even more relaxing for the muscles.
Interesting. So deeper muscle pain, maybe give infrared a shot?
Possibly, yeah. But as always, it's best to check with your doctor or physical therapist first. Make sure it's right for you. Oh, and I almost forgot, we've got those hydrocollator packs too.
Those I'm not so familiar with. What's the deal with those?
So those are interesting. They use moist heat. And a lot of times people find moist heat to be more, I don't know, like it gets in there better, really soothing. Good for things like arthritis, muscle spasms, that kind of thing.
Huh, good to know. Okay, so that's a lot of options just on the heat side. What about cold? How are people using that for back pain?
Right. So cold therapy, you've got your trusty ice pack. Can't go wrong with that. Especially if it's, a new injury, those first 48 hours are key, and ice can really help with the swelling and just numbing things out.
Yeah, ice pack is like the first thing you think of. What about those cold compresses? Are those basically the same?
They're similar, yeah, but those are usually a bit more flexible, so they can be easier to like mold to your body. Good if you need to cover a larger area or if it's, a weird shape.
Makes sense.
Yeah.
And okay, you also mentioned ice massage, and I gotta say, that sounds kind of intense. But also, I'm intrigued. When would you use that?
So that's definitely more of a targeted thing. Basically, you take an ice cube and rub it over the area, gently, of course, and that can be really good for certain types of pain, like tendinitis or plantar fasciitis.
So probably best to like have a physical therapist show you how to do that one right.
Yeah, probably a good idea. Now, the other thing I mentioned was cold water immersion. That's more of an athlete thing, like ice baths.
Right. Ice baths. Okay, so is that something like the average person with back pain might try?
It can be helpful, yeah. Good for overall inflammation, muscle soreness, that kind of thing. But it's not usually the first line of defense for like everyday back pain.
Definitely seems like one of those proceed with caution situations. Maybe talk to your doctor first.
Uh,
Okay, this is a lot of good info. But I think it's only fair to, look at both sides. We've been talking about all the positives, but are there downsides to heat and cold therapy? Things people should watch out for?
oh, absolutely. I mean, heat and cold therapy are generally pretty safe, but like anything, you gotta be smart about it. There are definitely things to watch out for. With heat, for example, burns are a risk.
Right, which seems kind of obvious, but I guess it's easy to overdo it.
Exactly. Like with those heating pads, always use a low setting and never, ever fall asleep with one on. That's asking for trouble.
Noted. And I guess it depends on the type of heat too, right? Like you were saying, moist heat can be good, but
Yeah, so moist heat, it can be really effective, but it can also cause burns more easily if you're not careful. Always check the temperature before you put it on your skin. And using a towel as a barrier is never a bad idea, just an extra layer of protection.
so even if it's supposed to be good for you, still got to be careful. What about those times when you just shouldn't use heat at all?
Yeah, good point. So, heat is great for chronic pain, right? But if it's a new injury, if you've just hurt yourself, heat is usually a no-go, especially in those first couple of days when there's a lot of inflammation. Heat can actually make that worse and slow down the healing.
So new injury, ice it, don't heat it. Got it.
Exactly. Now, with cold therapy, the main thing to watch out for is frostbite. And I know it sounds obvious, but you'd be surprised how easy it is to get frostbite if you're not paying attention. Especially with those instant ice packs, those things get seriously cold really fast.
Oh yeah, those are no joke.
Right, so the key is never put anything super cold directly on your skin. Always use a towel or something in between. And kind of like with heat, you don't want to use cold for too long either. It can actually be counterproductive if you overdo it.
Everything in moderation. Right. Makes sense. Okay, last thing I wanted to touch on, alternating heat and cold. Is that a real thing? And does it work?
It can be really helpful for some people, yeah, especially if it's chronic pain and you get those flare-ups now and then. So the idea is you use the heat first to get the blood flowing, relax everything, and then you switch to cold to bring down any swelling.
So it's like you're creating this pumping action, kind of flushing everything out.
Exactly. A lot of people find it really effective. You might try like 15-20 minutes of heat and then 10-15 minutes of cold. See how your body responds.
Worth experimenting with. But as always, probably best to run it by your doctor or PT first, right?
Always a good idea. Everyone's different, and they can help you figure out what's best for your specific situation.
This has been super informative. Really appreciate you breaking it all down. Heat and cold therapy, it seems so simple, but there's actually a lot to it.
That's the thing, right? We think we know these things, but when you really get into it, there's always more to learn. And when it comes to something as common as back pain, knowledge is power.
Absolutely. Well, on that note, big thanks to everyone for joining us for another deep dive. Hope you learned some new tricks to help manage that back pain. And until next time, take care of yourselves.